Okay. So if we go between the first and second toe, if we just drop into this web space here, just where we feel that initial indent, that is liver 2. If we follow that line all the way up to the metatarsal joint and drop back down again, that's liver 3. That's in the first dorsal interossei, and that's going to be innervated by the lateral plantar nerve. If we find the second and third toe and we just drop into that web space there, that's going to be stomach 44. If we find the fourth and fifth web space here and we just drop into here and we put the needle into there, that's going to be gallbladder 43. There's also an extra point here, which makes a 4-point combination as well that's collected together. Now, if we look on the medial aspect of the ankle and we go directly behind the medial malleolus towards the Achilles tendon and we sight our needle into here, this is kidney 3, this is going into Cagus fat pad, and this is where the tibial nerve is branching to the calcaneal and medial plantar nerve. Also, if we then place our little finger on the vertex of the medial malleolus and we run 4 fingers up along the tibia and we roll behind the tibia here and we go into flexor digitorum longus, this is spleen 6 and this is the tibial nerve as well. If we then have a look on the lateral aspect of the ankle here, if we go behind the lateral malleolus and we drop into this space here, halfway between the lateral malleolus and the Achilles tendon, this is bladder 60. Again, this is going into Cagus fat pad, but we'll have the sural nerve coming down here and branching to the calcaneal and lateral dorsal cutaneous nerve. If we look over here on the lateral aspect of the ankle and we move to the anterior inferior aspect of the lateral malleolus in the region of the anterior talofibular ligament, we have got gallbladder 40 here. And then if we move down along between the 4th and the 5th metatarsal, just outside the 5th digital tendon here, and we slip into this space here, this will be gallbladder 41, and the needle is going to be angled down as if you were standing, and this is going perpendicular to the floor there. If we move up here onto the tibia, if we find the tibial tuberosity and we slide down the tibial tuberosity here to where tibialis anterior just starts to encroach here, which should be about 4 fingers down from the joint line to about here, and we drop 1 thumb's breadth over into tibialis anterior, this would be stomach 36 there.
4 fingers down from the joint line, not the tibial tuberosity. Joint line, okay. Yeah.
It's in line with the inferior aspects of the tibial tuberosity,
yeah,
which is 4 fingers down from the joint line.
Okay, thank you. Thank you so much.